to the 2020 MIPS Final Rule Q&A webinar hosted by GPM Corp. We're really excited to have you here today and to answer your questions regarding the changes to the program and about MIPS in general. Our presenters today will be Katie Kelly, GPM's EHR Trainer and Regulatory Programs Coach, and Jenny Lee, GPM's Regulatory Affairs Director. Just as a brief overview, the webinar is going to be covering some of the finalized high-level changes to the program and how you can find success. This webinar is suited for you if you're either a GEHRIMED user who participates in MIPS or a long-term care professional who participates in MIPS but wants to learn how to be more successful given the changes and within the program in general. Throughout the webinar, if you have a question on a topic that one of our presenters is covering, please open the questions pane from the GoToWebinar panel and submit your question. At the end of the webinar, our presenters will be answering pre-submitted questions and questions submitted by the audience during the course of the webinar. If your question doesn't get answered, know that we will be sending out an email following the webinar with detailed answers to the questions that we weren't able to get to. Now, please join me in welcoming Katie Kelly, who will be going through our agenda today and proceeding with the rest of the webinar.
Hey, everyone. Thank you, Matthew, for that nice introduction. And I'd like to thank everybody who is on the line to join us today. We realize that your days are not like they've usually been. Things are atypical. You are probably busier than you've ever been, working in ways that are more stressful than ever. So we do very much value the time that you're spending with us and want to show appreciation for you joining. The agenda today includes a review of the 2020 final MIPS updates, an overview of 2020 MIPS reporting, and just general reporting, but also the ways that GEHRIMED facilitates reporting and that GPM supports you as somebody who does report MIPS data. And then finally, there will be a Q&A session that will run from the time the presentation is over until the webinar concludes at approximately noon. Before we talk more about how 2020 changed, let's just level set for a moment and talk in general about MIPS and what it is and why you care. MIPS stands for Merit-Based Incentive Payment System. It was implemented as part of a piece of legislation known as MACRA that passed in 2016, and 2017 was the first year that MIPS became a program. It is, like I said, a merit-based incentive payment system. So it is essentially a way that as an eligible clinician, you can document the care of your patients in a way that demonstrates quality within the bounds of this program that CMS has implemented. And there are scores assigned. So you could earn a score anywhere from 0 to 100. And we'll talk throughout the webinar today about what numbers are important for you to know and how you earn points. But just know that this is a program through which you earn points, report those points to CMS, and then CMS makes determinations about how your participation in the program will influence the way that you are paid on your Medicare Part B claims. So the very first thing that you need to know when thinking about MIPS is whether you are even eligible. So there are eligibility standards for MIPS, and in order to be considered eligible, you've got to exceed these low volume thresholds. There were no changes from the 2019 low volume thresholds. So if you're familiar with those thresholds, just know that for 2020, there are no changes. That doesn't necessarily mean that your status hasn't changed. Your status can change from year to year. So every year, you would want to evaluate your status and understand if you are considered an eligible clinician in this program, or if you're excluded from the program, or if you're somebody that is in between and considered an opt-in eligible provider. So to be excluded from MIPS all three of the following criteria that you see here must be true. So you would need to bill less than $90,000 in Medicare Part B claims, provide care for fewer than 200 Medicare Part B beneficiaries, and provide fewer than 200 covered professional services. If you do not exceed those criteria, you are not considered eligible. However, if you meet one or two of those criteria, you can opt in. And when you opt in, you're basically declaring that you would like to be considered an eligible clinician and you would like to be scored and participate in the program. Opting in is something that you would do when it's time to report your data in early 2021. So you don't have to make that decision right now. You could always participate, see how it goes, evaluate your numbers when the time comes, and then make a decision if you opt in or not. If you are determined by CMS according to these criteria to be an eligible clinician, then you operate all year knowing that you're an eligible clinician and that you are expected to participate and submit data. If you have questions about your status, there is a link at the bottom of this screen, and you simply go to that link on the QPP website, which stands for Quality Payment Program, and enter your NPI, and then you'll be able to see your status for all of the years 2017 through 2020 and your MIPS participation status for every year of this program. So speaking of scoring, we talked about that 0 to 100 range of scores. There are some changes for 2020 to what constitutes a passing score. And the passing overall score for MIPS for 2020 has increased to a 45. So on that scale of 0 to 100, an eligible clinician or an opt-in clinician would need to score a 45 or more in order to avoid a penalty. So any score below 45 potentially receives a penalty, which is a reduction on Medicare Part B claims in the year 2022. A 45 would be a neutral payment adjustment, no penalty, but also no incentive. And a 46 or more potentially receives some sort of incentive money. The penalty changes for 2020 also, so it is increasing again, this time to 9%. So a score below a 45 potentially will result in a 9% penalty on Medicare Part B claims that are paid to you in the year 2022. The exceptional performance standard has increased, so that is jumping from 75 to 85. And this is important to know because if you are a clinician who wants to participate and maximize this program, getting every possible benefit from it that you can, you would need to score an 85 or higher in order to receive that exceptional performer bonus. So a score above 46 will likely receive some sort of small incentive, and 85 or more receives a portion of a separate bucket of funds that are set aside for exceptional performers. This is a budget neutral program, which means that the incentive money that's paid is essentially coming from the penalty money that is paid into the program by those who do not meet the minimum score. And then once that amount of funding is estimated, CMS distributes it amongst the people who scored a score of 46 or greater. If you score an 85 or greater, there is an extra bucket of money set aside for those performers to get an exceptional performers bonus on top of whatever small incentive the others were receiving. And the amount of the incentive potentially goes up for 2020. Now, keeping in mind that this is a budget neutral program, there is no way to truly know exactly how many dollars are available to be paid in incentive money until the 2020 data is reported to CMS and they've evaluated and understand how many participants did not meet the minimum, how much incentive or penalty money they'll likely pay into the program that then gets distributed as incentive money. So keep in mind, 5.79% is the absolute most that the percentage of the incentive payment could be. But in years past, it has been lower than that. Looking at 2020 and the category weights, there have been no changes. So if you are familiar with 2019 and the category weights, they have stayed the same. And when I talk about categories, there are 4 categories in this MIPS program. Improvement activities is 15% of your total score. Promoting interoperability is 25% of your total score. Quality is 45% of your total score, and cost is 15%. Same as 2019. It's important to point out that with quality representing 45% of your total score, and a 45 is the minimum score that you need in order to remain neutral and not incur a penalty, it really is going to be important in 2020 to participate in multiple categories. The only way to earn 45 points in quality would be to have perfect 10s in 6 quality measures. So you'll want to rely on some points from the improvement activities and the promoting interoperability category, and then cost, of course, CMS will make some sort of determination for based on your claims throughout the year. The MIPS dashboard integrated into GEHRIMED allows you to track these categories throughout the year, and this way there are no surprises. So feedback from our users has been that it is really important throughout the year to understand where you are. As the bar keeps moving higher and higher and you are expected to do more in this program in order to do well, it really becomes critical for you to understand month to month how you're doing and where your scores are, and if you are on track to have the score that you would like as the year draws to a close. So you'll see the improvement activities are tracked for you. That is an attestation category. So you do not have to put data into GEHRIMED to participate in this category. It is a way for you to identify activities that you have done through the year that you could potentially earn points for, and you attest to them in the GEHRIMED dashboard so that GEHRIMED helps to track those points for you. But on your own, outside of GEHRIMED, somewhere you are keeping documentation about those improvement activities. In the event of an audit, you would need to have documentation that those items were completed. The PI category tracks the way that GEHRIMED talks to other pieces of software, other certified technology. So it's looking at if you're doing e-prescribing, if you're sending electronic summary of care documents, if you've got patient portal information available for patients who would like to access it, and that's tracked for you within GEHRIMED also. And then, of course, quality measures. That number will change. It's pretty fluid throughout the year as you continue to put data into the system, since it is a 12-month category, and the dashboard very nicely tracks for you how you're performing as the year goes on. And then you'll see finally the cost category is included in the dashboard, but it is grayed out because there's nothing that you can do in GEHRIMED to influence the way you're scored in that category. CMS will apply cost points after your data has been submitted in 2021. Changes to the quality category for 2020, even though the component weight is the same, the category weight hasn't changed. There are some other things that you'll need to know. If you are a small group, scoring will remain approximately the same. You'll get 3 points for measures that don't meet or exceed the data completeness threshold. If you are a large group, a change for this year is that you will get only 0. You will not get any points. So in years past, if you answered just a small number of questions for a particular quality measure, you still might earn 1 point for that measure. For 2020, unless you've got that complete set of data for a quality measure, your score on that measure will be a 0. And when we talk about data completeness, the threshold for that is changing. So 70% is what you need in order to achieve data completeness on a quality measure. That means that for all of your eligible encounters or eligible patients, you need to answer for 70% or more of them in order to have what CMS considers a full set of data. And then you're still looking to answer for 6 quality measures. That way you maximize the category, pick 6 quality measures that you can answer 70% of your eligible patients and or encounters, depending on the type of measure that it is, keeping in mind that that data set has to include at least 20 to be considered full. So 20 answers, 70%. The reporting period is still the full year, January 1 to December 31st. If you have not yet started capturing quality measure data, that's okay if you're a GEHRIMED user. Once you turn a quality measure on in GEHRIMED, we've got logic built in that goes back and finds all of your eligible encounters or patients from January 1 through the current day so that you can ensure that you are answering for all 70% of the requirement. And here's a glimpse of the detailed portion of the dashboard that helps you track this. So we talked about how tracking is important and you don't want any surprises. You want to know throughout the year if you are going to get to the numbers that you need in order to demonstrate success here. So from the dashboard that we showed earlier, if you were to click on the quality measure category itself, it would launch this window that shows you detail. And in this detailed view, you can see all of the quality measures that you are capturing data for, what your denominator is, which is all of your eligible patients or eligible encounters, again, depending on the type of measure that it is, along with the reporting rate and the performance rate. And these are important because that reporting rate is the number that you need to get to 70. Once that reporting rate gets to 70, then your score will increase. So the screenshot here was taken from a small practice, which is why you can see that these measures that have a reporting rate lower than 70 are at 3. Again, if you were a large practice, those will now be 0. But for a small practice, you would still earn 3 points for a measure that does not have complete data and a reporting rate of less than 70. But once your reporting rate reaches 70, then your score can increase. And the amount of increase that you see in your score depends upon the performance rate. And the performance rate is showing you the percentage of times that your answer meets performance, demonstrates quality according to the guidelines set in the benchmarks by CMS. So you'll see that your score for the measure can change throughout the year. I spoke to someone just yesterday and she said, you know, we had 9 points for this measure and now we have 8 points for the measure. But your performance rate will influence what your measure score is throughout the year as you capture more and more data. There have been some changes to the improvement activities category this year. It's been a while since improvement activities was changed. New for 2020 is that 50% of your participants in the group, if you are doing group reporting, must complete the activity in order for you to get credit for it. In years past, only one member of the group had to complete the activity. Now the minimum is 50%. So 50% of you, if you are reporting as a group, must be able to attest that you have completed this activity within a 90-day reporting period. Many of our customers just choose to report for the entire year, but if you were to be audited, CMS would ask for a snapshot, a 90-day window. So as you're preparing your documentation for improvement activities, keep in mind that there is going to be a look back to a specific 90-day window. It can be any consecutive 90 days that you choose. It doesn't have to be a specific quarter. It doesn't have to be like January 1st to March 31st. It can be any consecutive days of your choosing. One recent change to improvement activities is a new high-weighted improvement activity that was just introduced by CMS. And these activities do have weight associated with them. There's high weight, there's medium weight. So if you are a small practice, you'll want to report 1 high weight activity or 2 medium weight activities. If you are a large practice, meaning 16 or more, you'll report 2 high weight or 4 medium weight, or you could do 1 high weight and 2 medium weight. But this new activity that was just introduced by CMS is a high-weighted activity. It promotes participation in COVID-19 clinical trials and clinical reporting for COVID-19 care. So if that's an activity that interests you, reach out after the webinar and Jenny and I can provide you with more information. Now, understanding how the data is captured and what the data means and all of these category buckets that the data comes from, and the fact that you could score somewhere between 0 and 100, you want to decide what your objectives are and set a plan and come up with a strategy and some goals and understand where you want to get. So if you are looking to simply, we describe it as walk, which would mean you earn 45 points. You've got a neutral payment adjustment, no penalty, but not much. Actually, no. If you're exactly at a 45, there will be no incentive either. Or perhaps you think, well, I'd like to land somewhere in the middle. I don't necessarily need to get to 100, but I don't want to be at 45 either. Let's see if I can find a score somewhere in the middle. We would refer to that as a jog pace, earning somewhere between 45 and 84.9 points. So exceeding the minimum, but not quite getting to that exceptional performance category. If you want a piece of that exceptional performers category, we would call that a run pace, where you're doing everything that you can. You've got to participate in all of the categories to get there. And we have plans to help you achieve whatever your goal is. So along with the technology and the dashboards that live in our product in GEHRIMED, we also can support you with coaching calls. And generally speaking, for a new GEHRIMED user, the frequency of coaching calls will probably correspond to these scores. So if you are a new user to GEHRIMED and you say, I think I would like to walk this year, that's probably accomplished with 2 coaching calls. Jog probably is accomplished with quarterly coaching calls, and then we would want to speak monthly to review your data and look at your scores if you truly want to run and achieve the highest score possible. And during those coaching calls, we can discuss the particulars of your situation and whether you think that group reporting or individual reporting is ideal for you. You've got options, and you don't have to decide before it's time to report. You don't have to decide now. You can make that decision after the year has ended and all of your data has been collected. You might report as an individual, or you might report as groups. And like I said, the great thing is you don't have to decide that now, and there are strong cases to be made for either option, but really a lot of it depends on what the group score is. So essentially, if you're reporting as a group, your data gets aggregated, and it's not an average of scores, it is a true data aggregation. So it allows you to work together as you treat patients to provide quality measure answers as a group, so that if one of you answers a question, no one else in the group is required to. And this is really a great way to increase the scores of members of the group who perhaps joined midway through the year or didn't include a whole lot of data in the group's data set. It really is a good way to elevate the scores for those folks, because when you report as a group, everyone in the group gets the exact same score. Now, you might say, well, my group includes some high performers and we don't want to hold them back and have them limited to the score that is the group score. If you've got high achievers in your group who score higher than the group score, you could potentially report both ways for those people so that everybody stays safe by getting the group score, and then the high achievers report their individual data. CMS will apply the higher of the two scores to those individuals' NPIs so that your high performers can reap the benefits of the extra work that they did. Now, one thing to consider for 2020 is the promoting interoperability hardship. There were no changes made to this from 2019. So if you applied and received the PI hardship for 2019 and that's your plan for 2020, that seems like a solid plan. The application for the PI hardship will be made available sometime this summer. CMS normally puts that out there in August, and once they announce that it's available, we'll share it with our customers and make sure you understand where to go to apply. How to apply is very simple. You essentially put in your tax ID or your NPI, click the reason that you are applying, and the next slide will show what those possible reasons are. Most times, the approval comes back in the same day. We normally suggest that it's a great idea to attempt the PI category and do the things that it would require you to do to earn points. And then if you have the option to take the hardship exception, if your scores are not where you want them in that category, you have that as a backup. And here are the reasons that you could apply for the PI hardship. I'll note that there are some clinicians, as you'll see on the right side of the screen here, who are automatically eligible for that reweighting, and they don't need to apply. So the great benefit to applying for the promoting interoperability hardship exception is that once it's approved, those 25 points that would potentially come from the PI category get reweighted into your quality, and now quality is potentially worth 70 points. So it is a strategy that you can implement if you want to run, if you are a nurse practitioner or a physician's assistant and you don't use e-prescribing in GEHRIMED and you still want to achieve a high score, this PI hardship exception might be a good option for you. Okay, so that concludes the slides that we had prepared. Let's start with the Q&A session. And I've been asked to make one clarification about the improvement activities slide. The first written statement on the improvement activities side said that one clinician needed to engage in improvement activities. That was indicative of the 2019 requirements. So 2019 and previous years was when one clinician needed to participate. Now in 2020, it is in fact 50% if you are reporting as a group that need to complete the improvement activities. So when you registered for this webinar, you were given the opportunity to submit questions to us, and we have prepared those questions, and we'll start our Q&A with those questions. And then as we wind down with those questions, we can answer questions that you have been submitting throughout this broadcast. I will turn the presentation over to Jenny Lee, who will answer our first question.
Hi, good afternoon. Can everyone hear me?
Yes, I hear you, Jenny.
Wonderful. Thank you, Katie. So this is Jenny Lee. I'm the Regulatory Affairs Director for GPM. And again, I echo Katie's sentiment that we greatly appreciate you joining today. And I'll go ahead and get right into the questions because we have several. This is one that has come up several times, of course, given the nature of what has been going on lately. And that is if any of the CMS waivers and recently announced regulatory flexibilities will be impacting MIPS 2020. And as everyone knows, there was quite a lot of changes to 2019. They extended the submission window. They extended some flexibilities around hardships. However, they have not specifically announced any changes to MIPS 2020 reporting. So as it stands right now, providers are expected to be participating in MIPS 2020 as they would have in any previous years, based on eligibility, of course. However, we do anticipate that CMS will be making some kind of address about this in the upcoming rulemaking, the rulemaking cycle, which is in June, July. So while they have not announced, pardon me, any specific changes in the interim, pardon me, in the interim final rules that have been coming out as a result of COVID updates, we do anticipate that they might address that in upcoming rulemaking in June or July. So as soon as we hear anything, of course, we will let you know. Katie, I'll pass it back to you for the next question.
Okay, great. The next question was, what exactly is MIPS and how can I make sure I am in compliance? And we talked about that a little at the very beginning. MIPS is that acronym that stands for Merit-Based Incentive Payment System. And it is a program by which clinicians who are eligible submit their data to CMS and then are scored accordingly. So the way that you make sure you're in compliance for 2020 is to collect enough data amongst these categories that you have a score at 45 or greater. And there are a number of different ways that you would submit your data. So you collect the data throughout the year, but then it needs to be submitted to CMS in order to be in compliance. The submission window for 2020 data is January 1 through March 31st of 2021. And there are various ways that you can submit your data to CMS. You can submit directly through the QPP website. They have a portal and you can submit data that way. And we at GPM are a QCDR, so we can submit data on your behalf. And we have built systems integrated between GEHRIMED and the CMS system so that if you're familiar with GEHRIMED and you are a user, you'll know that once your data has been collected in GEHRIMED, you can submit directly from GEHRIMED to CMS in order to ensure compliance and make sure that that data gets submitted to right where you need it. Okay, next question was implementing MIPS for the first time in a private primary care practice. So if it's your first time participating in MIPS, the very first thing, in my opinion, that you need to do is make sure that you have identified quality measures that you will answer and begin collecting data immediately for that category. Because quality is a 12-month category, it's not too late to do well in that category, but the longer you wait, the more catch-up you have to do to get to that 70% number that you need for data completeness. So first step, in my opinion, is get the quality measures worked out, identify the 6. You can report on more than 6. If you report on more than 6, CMS will accept whatever your 6 highest scoring measures are. But to do as well as possible in this program, you should report on 6 measures. The first step would be to identify what those measures are and how you'll collect that data and get it to CMS. Jenny, the next question's for you.
So the next question is addressing MIPS requirements for SNFists, so providers that practice in long-term care, subacute care, primarily, a skilled nursing facility. So while there are some, specificities around, the types of providers in those facilities, first it would, be based on MIPS eligibility. So, assuming that the provider is, eligible to participate in MIPS, the primary difference really would be what kinds of quality measures they select. So, the standards would be the same in terms of what the minimum requirements are, but providers, in skilled nursing and subacute care, they would have, very, specific quality measures, which, is one of the things that, GEHRIMED does support is measures that are, specific to long-term care providers. And of course, if there's, any additional questions or any additional specificity that a provider would like about that, that's where, Katie and I are happy to take that conversation offline to, kind of structure like a, more custom program for how to be the most successful in the MIPS program. Katie, back to you.
Okay, thanks. The next question was around GPM configuration to meet the requirements, updates, and readiness. And I'm going to pair that with another question that came in asking when will the 2020 MIPS dashboard be ready to use? So yes, GPM does have configuration to meet all the requirements. We showed some screenshots of the dashboard and the way the dashboard looks and how it allows you to track your progress compared to the requirements so that you know throughout the year how you're doing. As far as updates and readiness and when is it ready to use, the MIPS dashboard for quality is actually currently updated and ready to use for 2020. So on May 1st, the data that's displayed in the MIPS dashboard is now your 2020 quality measure data. There are still some updates to the dashboard coming. The header at the top of the quality screen says 2019, but we've looked at some tests side by side with other views within the system and are confident that the data that's displayed for your quality measure data currently in GEHRIMED reflects your 2020 encounters and 2020 patients. We've got some updates to make to the improvement activities category because of the changes surrounding the way that category will be calculated. And we've also got updates to make about the calculations for quality. So the reporting rate will need to update to 70%. We'll make that update along with some other small changes as far as the way that the category is scored and the measures specifically are scored no later than the end of May. Any next questions to you?
So the next question is how clinicians can review and challenge MIPS data submitted by their employers. So, we do encourage providers to, work closely with their employers to, review any data before it is submitted to CMS. So, that's a very important step in the process. However, once the data has been submitted to CMS, for example, CMS announced, that they have received most of the data now, and they have what's called like a preliminary feedback, which means that while the data is not completely finalized, so CMS is still, performing several final calculations to MIPS data between now and July 1. Providers can already see what they have submitted, and then after July 1, they can request a review directly with CMS to address any inconsistencies if there are any. So there are, two avenues with that. And again, the process that we provide here at, GPM GEHRIMED is to, ensure that your data is, as complete as it can be before it's submitted. But of course, we always encourage providers to, to work with their administrators to make sure that everything is good to go before, it gets submitted. But again, you can always, reach out to Katie and I with any questions.
Thanks, Jenny. The next question is about provider education. So we do have 2020 MIPS information on Zendesk, our user community. We've got all of the categories updated for 2020, including links to the specifications for the quality measures that are currently live in GEHRIMED. If you really want to get deep in the weeds with these quality measures, you could go look at the CMS specs. And of course, Jenny and I are available if you've got specific questions that the education that we've provided on Zendesk isn't helping you with. And then also that's one function that the coaching can serve too. If we are conducting coaching calls throughout the year, we're available to answer the questions that you have that you maybe didn't find answers for or don't have the time to go look for answers for. And we've even used some of these coaching calls in the past as education sessions for the clinicians within our groups. So if you wanted to use one of your coaching sessions to do a a training session where we can do a screen share and walk providers how to answer quality measure questions and how to track their own progress, we're happy to provide that service for you through one of these coaching calls, and we can even record the call and then provide you with the copy of the recording so that you can use it as you educate new clinicians that your group hires throughout the year. Any next questions to you?
Great, thanks, Katie. So this one came in as effects on mobile in-home physician services. So we interpreted that to mean, how does the MIPS program, impact providers who provide in-home physician services? And really, it's when it comes to the quality measures, the CPT code determines the eligibility. So, if you're performing an in-home visit, there's only certain quality measures that would be applicable in that situation. So it would really be kind of like on a case-by-case basis. If that was kind of an incomplete answer because the question was not quite thorough, we'd be happy to follow up on that. So please, use the chat feature or email us directly and we can elaborate. Katie, back to you.
All right, thanks, Jenny. So a couple of the questions that we have here I think were addressed. One question was, what were the biggest changes from 2019 to 2020? Really, the biggest changes were in the differences in minimum requirements, increasing that minimum score from a 30 to a 45, increasing your data completeness from 60 to 70%, and then, of course, the penalty changing from 7% to 9%. And that goes along with the next question on my list, which is, what is the most important issue? And in our opinion, the most important issue is not getting a penalty. Really, the very first primary focus for you as far as this program is concerned is learning if you are considered eligible, and if you are an eligible clinician or an eligible group, ensuring that you meet the requirements to score at least a 45 so that you do not incur a 9% penalty on your Medicare Part B claim. The next question is, how are you supporting practices through these changes? So we do have this in-house regulatory team headed by Jenny, who evaluates the rules as they come out, evaluates changes to the program as they happen throughout the year when an emergency like this COVID pandemic comes up and CMS makes some changes to the requirements of programs. We've got an internal team that is well aware of what CMS is deciding and how they're communicating, and then we can ensure that our customers are also aware of these changes. And we also support practices through the coaching that we offer. If you are a registry customer of ours, a QCDR customer, and you're using GEHRIMED to submit your data to CMS, that comes with 2 coaching calls. You automatically, as a customer of a QCDR, get these 2 coaching calls. So early in the year, we can look at how you're set up, craft the plan, understand what your strategy is, determine what steps you need to take throughout the year to meet your objectives, and then close to the end of the year, usually in November or December, we get together one more time, take a look at your data, take a look at your scores, and if you want to improve upon where you are at that point, look for areas of improvement. So and then obviously have support through our support team that can direct you to Zendesk if you have specific questions about specific measures or categories within the program. And Jenny and I are available to you also throughout the year if you need assistance or have questions. I think, well, okay, so we just got a couple more questions here. Jenny, do you want to look at your last one, and then I'll wrap up with that final one on the list?
Sure. So we received a question about overall review of quality measures. So echoing what Katie had just stated, we do have an internal panel of experts that review quality measures annually. With the way that the rulemaking cycle works, we often do not know which quality measures we will be able to support in a coming year until, very late in the year, because CMS makes so many changes, additions, omissions, deletions. So we do convene, internal experts, to review what measures are the most applicable in places of service, based on CPT codes, based on workflows. So it is, it's a very in-depth process every year. And we are, fairly limited in the long-term care space with, quality measures that are, worth anything, because several measures are topped out. MIPS quality measures are not very ideal for the places of service that our providers are practicing in. So it is a bit of a struggle annually, but, we do very much take into consideration input from, like I said, an internal team of expert panelists who are from, their providers, their administrators, so that is an iterative process. And we do, welcome feedback from GEHRIMED users as well. So if you have specific questions and concerns, we are always happy to hear those.
Yeah, thanks, Jenny. And to go along with that, I don't know that it's been broadly announced, but we are introducing one more new quality measure for 2020, which is number 290, the Parkinson's disease measure related to symptoms of Parkinson's disease. And we expect that to be ready by the end of May. And that was actually a measure that was brought to us, suggested to us by a couple of our customers. So it was reviewed through this internal process and was determined that it very likely was going to be a good fit for our customers and will be implemented this year as a result. And so the last question, unless we have any others that get submitted to us here in the next few minutes, is how will telemedicine visits affect MIPS? And I know this is an important question right now because so many of your visits are completed through telemedicine. But even before the COVID-19 pandemic hit and telemedicine became something that was at the forefront of the way you're seeing patients, that logic was already built into GEHRIMED. So CMS, for all of these quality measures, provides us with detailed specs. And every year when we make our updates to these measures, we update the details from the specs that CMS provided. And included in those specs are the CPT codes that are going to trigger eligibility for these quality measures. So along with the CPT codes, there has always been a mention in these specs whether the telemedicine modifiers would exclude a visit from quality measures or not. So that logic is present in GEHRIMED. It was there before you started doing telemedicine visits as a result of COVID-19. So you can feel confident that as you have had to transition your practice and the way you're seeing patients to telemedicine, because so many of you have had to do that, that the quality measure logic is still there. It's still capturing the right visits as long as you are using the CPT codes and the telemedicine modifiers as instructed by CMS. So if there have been no other questions, and I don't believe there have, I will hand this back over to Matthew.
Thank you, Katie and Jenny, for being able to take the time today to share with us your knowledge and expertise on the MIPS program. And thank you to everyone who attended and submitted questions to the panel. We really do appreciate it. I just wanted to point out that following the webinar, we will be sending out an email that contains a link so that you can watch a recorded version of the webinar today, alongside detailed answers to the questions that you submitted during the course of the webinar today. Additionally, if you are a GEHRIMED user and you have more questions on how to be successful in MIPS, please reach out to Katie, Kelly, and Jenny. They would be more than happy to help. And if you aren't a GEHRIMED user and you have any outstanding questions or you wish to have a more detailed conversation with our team to learn more about how GEHRIMED can help you succeed, please contact sales@GPM and we'll be happy to help. Otherwise, I hope that you all have a wonderful rest of your day.